Welcome, everyone. This is Dr. Mercola, and I'm here today with Dr. Natasha Campbell McBride, who is going to enlighten us about an interesting topic, which is gut and psychology syndrome. And it really is a natural treatment for autism, ADHD, dyslexia, dyspraxia, depression, and schizophrenia. So welcome, Dr. Campbell.
Thank you. I'm delighted to be here.
Okay, well, we're delighted to have you. And could you tell me a little bit about what your training is, and clinically and academically, and how you acquired your expertise in this area?
I'm a medical doctor, and I got my first postgraduate degree when I was a young doctor in neurology. And I worked as a neurologist and a neurosurgeon for 7 years. Then I started my family. And my firstborn son was diagnosed autistic at the age of 3, which threw me into a huge learning curve because I had to find a solution to his problem, because my own profession had nothing to offer, which was a bit of a shock for me. And having found all those solutions, I went back to university. I completed a second postgraduate degree in human nutrition and learned many more other things. And as a result, my son fully recovered. He's not autistic anymore. He's leading a normal life. And I have a clinic in Cambridge, in England, in the UK, which is very busy with children and adults with learning disabilities, neurological disorders, psychiatric disorders, and children and adults with immune disorders and digestive problems.
Interesting.
Sorry.
And what country did you receive your medical training in?
I'm Russian,
and
I was trained as a doctor in Russia, and I practiced as a doctor, as a neurologist in Russia. Then I started my family, moved to the UK. So the whole disaster with my first child happened in the UK.
Was your child born in the UK?
Yes.
Okay.
Yes, he was born in the UK, and now I've lived in the UK for the last 20 years and have practiced here.
Well, that's and how long did it take you to acquire the expertise and understanding to be able to nurture your child through the autism challenge and back into a normal functioning child?
Well, many parents understood, and I understood the same thing, that children are given to us to teach us lessons. And the learning curve is very fast and very steep, usually, particularly with a child with autism. Because the younger the child is, when you start the treatment, the better the results are. The longer you let the child sit in that autistic fog, the more difficult it is to pull them out of it. And the less impressive the results are. So when you start the treatment, GAPS treatment I'm talking about now, at the age of 2, 3, 4, up to 5, you give your child a real chance to completely recover from autism and ADHD and ADD and dyslexia and dyspraxia, and that larger group of children who do not fit into any diagnostic box. They may have a little bit of autism and a little bit of ADHD and a little bit of dyslexia and a little bit of dyspraxia and a little bit of something else, but none of it is conclusive enough to fit that child into a diagnostic box. These are the children with whom doctors usually procrastinate. They ask the parents to bring the child in 6 months, then again in 6 months, to observe the child in order to just give the child a diagnosis. And a very precious, very valuable time gets wasted that way, while the child could have been helped.
And when did you graduate medical school? What year?
I graduated in 1984.
Okay, so about the same time I did. And do you recall the incidence of autism around then? Was it about 1 in 100,000 or so? And then what is your current estimate as to the incidence today or in the UK?
It was 1 in 10,000 when I graduated. It was a very rare disorder, and even I, as a medical graduate, have never seen an autistic patient. By the time I graduated from my medical school, I have never seen an autistic individual. I have seen other psychiatric conditions through my course in psychiatry, but I've never seen an autistic child. And to be honest, the first autistic child that I've encountered was my own. As I say, 20 years ago in the Western world, certainly in the English-speaking world, we were diagnosing 1 child in 10,000. 15 years ago, we were diagnosing, and 5 years ago, we were diagnosing one child in 150, which is almost a 40-fold increase in incidence. And now in Britain, in some counties, we are diagnosing one child in 66.
Wow.
And as I understand, the numbers are similar in some states in America, in some areas of the states in America.
Mm-hmm.
And the same in Australia, and the same in New Zealand. And I've just come back from Hungary. The incidence there is not as high, but it is getting close to one child in 150.
So in your review, I mean, that's a dramatic increase, basically 50-fold increase from the time you and I started practicing. So have you come to any conclusions as to what your understanding or beliefs are as to what are the primary contributing factors to this dramatic increase?
Absolutely. I have no doubt whatsoever that these children are born with perfectly normal brain and perfectly normal sensory organs, and they're supposed to function normally. But what happens to these children, and that's my absolute belief, and that's what GAPS describes, gut and psychology syndrome. The very name establishes a connection between the functioning of the digestive system and the functioning of the brain.
Mm-hmm.
What happens in these children? They do not develop normal gut flora from birth, from the beginning of their life. And gut flora is a hugely important part of our human physiology. Recent research in Scandinavia has demonstrated that 90% of all cells and all genetic material in a human body is our own gut flora. We are just a shell, we're only 10%. We're a habitat for this mass of microbes inside us, and we ignore them at our peril. And what happens in these children? They develop very abnormal gut flora from the beginning of their lives. So as a result, their digestive system, instead of being a source of nourishment for these children, becomes a major source of toxicity. These pathogenic microbes inside their digestive tract damage the integrity of the gut wall. So all sorts of toxins and microbes flood into the bloodstream of the child and get into the brain of the child. That usually happens in the second year of life in children who were breastfed, because breastfeeding provides a protection against this abnormal gut flora. In children who were not breastfed, I see the symptoms of autism developing in the first year of life. So breastfeeding is crucial to protect these children. And what happens in these children? They are born with normal brains, normal eyes, normal ears, normal tactile sensitivity, normal taste buds. All these sensory organs are given to us to collect information from the environment. If you look at little babies, they look at everything, they listen to everything, they touch everything, they mouth everything, they taste everything. What are they doing? They're collecting information from the environment, and then that information from their sensory organs is passed to the brain to be processed. And as the brain processes this information, the child learns that this is mommy, and this is daddy, and this is a toy. I play with this toy like this. I don't do anything else with this toy. I don't destroy it. I don't throw it. I don't line it up. This is a spoon. I eat with it. These are people around me. I communicate with them in this way. But what happens in GAPS children? Because of this river of toxicity coming out of the gut and flooding into the brain of the child, the brain is clogged with toxicity and it cannot process this sensory information. Sensory information turns into this mush, into a noise in the child's brain, and from this noise the child cannot learn. They cannot decipher anything useful. That's why they don't learn how to communicate, they don't learn how to understand language, how to use language, how to develop all the natural instinctive behaviors and copying behaviors that normal children develop. And second year of life is crucial in the maturation of the brain of the baby. That's when communication skills develop, and our instinctive behaviors develop, and play skills develop in children, and copying behaviors develop. And if the child's brain is clogged with toxicity, the child misses that window of opportunity of learning and starts developing autism, depending on the mixture of toxins, depending on how severe the whole condition is, depending how severely abnormal the gut flora is in the child may manifest this condition as a bunch of symptoms which would fit into a diagnostic box of autism, or as another bunch of symptoms which would fit into a box of attention deficit hyperactivity disorder, or attention deficit disorder without hyperactivity, or dyslexia, or dyspraxia, or obsessive compulsive disorder, or something else. But I say in majority of cases, almost 80% of these children, they have such a mixture of symptoms that they do not fit into any diagnostic box neatly. And these are the children who miss out very important years at the beginning when they could have been helped.
So it's an interesting observation, and I'm sure it provides a phenomenal opportunity to have a therapeutic intervention which will make a difference. But the central question I have, I still a bit confused, because if it's the gut flora that is triggering this, there has to be something that caused the shift in the last 30 years. Unless they were spontaneously shifted to different flora, but something's causing different organisms to contribute to this pathology. So what's your speculation as to the variables or the factors that are contributing to the shift that's moving patients toward this gap syndrome?
Absolutely, it's a very good question. The epidemic of autism and ADHD and dyslexia and dyspraxia, we can use the word epidemic here, despite the fact that classically this word was used for infectious disease. Now we're using it for an epidemic of autism, because we indeed have an epidemic. The underlying epidemic causing all these conditions and causing these other epidemics is the epidemic in abnormalities in the gut flora. And I will explain how it happens. As far as science knows, the baby inside the mother's womb during 9 months of gestation is sterile. The baby's gut is sterile. When does the baby acquire its gut flora? At the time of birth, when the baby goes through the birth canal of the mother. So whatever lives in mom's birth canal, in mom's vagina, becomes the baby's gut flora. So what lives in mom's vagina? It's a very richly populated area of of a woman's body. The vaginal flora comes from the bowel. So if the mother has got abnormal gut flora, she will have abnormal flora in her birth canal. Fathers are not exempt, because fathers also have got a gut flora, and that gut flora populates their groin, and they share their groin flora with the mother on a regular basis. What I find in my clinic, before I talk about the child, I always collect health history from the mother, the father, and preferably even grandparents of the child. And what I find that we have an epidemic, a growing, a deepening epidemic of abnormalities in the gut flora, which began since Second World War, when antibiotics were discovered, and with the courses of antibiotics, because every course of broad-spectrum antibiotics wipes out the beneficial species of microbes in the gut, which leaves the pathogens in there uncontrolled. Because in a normal, healthy digestive system with a normal, healthy gut flora, the beneficial species of microbes predominate, and they're called probiotics. We have probiotics bacteria, probiotic viruses, and probiotic yeasts, and beneficial worms, even, and beneficial protozoa. But the broad-spectrum antibiotics wipe out the beneficial bacteria. In parallel with beneficial microbes in a healthy gut, the scientists have found now thousands of different species of downright pathogenic, disease-causing microbes, bacteria, viruses, fungi, and other microbes. But as long as the good ones predominate in the gut, they control all the pathogens, and they do not allow them to cause any trouble. They keep them in small colonies, and they don't allow them to proliferate. Every course of antibiotics wipes out the beneficial bacteria, and that gives a window of opportunity for the pathogens to proliferate, to grow uncontrollably, and to occupy new niches in the gut. The beneficial flora recovers, but different species of it take between 2 weeks to 2 months to recover in the gut, and that's a window of opportunity for various pathogens to overgrow.